Today we will be talking about motor learning in the task-based approach. To start, let's define what exactly is motor learning. Motor learning is the process by which practice and experience leads to permanent changes and improvements in an individual's capability for certain skilled movements. Through motor learning, skill acquisition leads to retention, which in return will lead to generalization. There are 4 factors of motor learning. Number 1 is initial situation. This encompasses the body position and task demand. Number 2 is parameters. This encompasses the muscle groups and eye-hand coordination. Number 3 is outcomes, or knowledge of the result. And number 4 is sensory consequence, which is how the movement is felt. The actual motor learning theory was created by Fitts and Posner, and it is encompassed by a 3-stage model. Firstly, we have the cognitive stage. Here, the patient develops a deep understanding of the task and the demands, skills, and strategies required to complete it. Secondly, there's the associative stage. Here, the client practices and refines their motor strategies for the task at hand. And lastly, there's third stage, is the autonomous stage. Here, the skill becomes automatic and no longer requires conscious attention. When it comes to motor skill acquisition, it is vital that patients are able to reach their full potential, so applying and abiding to certain tasks and functions allows for better acquisition. In this realm, therapists can utilize the just right challenge, where the therapist sets the patient up with a task that is challenging but not too hard that it's discouraging, rather just right, which is where it gets the name from. To really cement the skills learned and acquire the ability to generalize it to other tasks, clients need to utilize practice and repetition. By doing this and encouraging the patient to independently problem solve, patients are able to acquire a higher skill set. When it comes to implementing motor learning interventions, this model focuses on developing optimal motor and cognitive strategies that utilize remediation, adaptation, and compensation through a holistic approach. As stated before, we want to initially focus on outcome of movement, and then later, as they progress, work on motor performance and their overall proficiency. To implement these interventions, motor learning most commonly utilizes EBP, or evidence-based practices, such as mental practice, virtual reality, mirror therapy, and more. One that is most currently related to motor function and motor control for clients who sustain brain injuries is a task-oriented approach. The task-oriented approach can be defined by task-specific training, repetitive task practice, and goal-directed training. It focuses on the task and the client rather than that of the therapist. Unlike other functional movements, task-oriented interventions involve task execution that are not directed to a clear ADL goal. Rather, it focuses on the arm training using functional grasp of objects. It also involves context-specific environments that mimic everyday life scenarios, emphasizes exercise progression, and overall total skill practice. With feedback, individuals are able to enhance motor learning and improve their overall motivation.